Today's episode of the Warrior Mommy podcast is going to talk about a therapy that's colorful, that's fun, yet it's really, really important. But unfortunately, parents, I am one of those parents who realize the importance really later. And it's a lesson that I learned the hard way. So I just wanted to have an impactful episode. And for that, I have two gurus. I respect them. I have seen their work. I have heard parents talk about how they've changed their children's life. So I'm really honored to have both of them in the studios. My first guest is, we love him. We have seen him work with tons of families here in Dubai. He's the CEO of an amazing clinic that we'll talk about later as well, Mr. Adam Griffin. Thank you so much. It's my honor. It's my pleasure. He is actually the OT guru that everybody loves in Dubai. My second guest has a very beautiful name that I could not pronunciate right. We call him DK. He's going to tell you his name yourself because I don't want to pronunciate it right live. So he is the head of Georgetown Early Intervention Center. He's a medical director as well. And we call him DK, and his full name is
Jnaneshwar Kakre.
Welcome to the podcast, DK. It's a pleasure, and he's a hidden gem. He has been changing lives, and he stays behind the curtain. But DK is the OT that you should see if you're in Dubai. So I'm going to start with you, Adam, about two senses that are very difficult to pronunciate, yet very important. And I feel that parents do not know about it in their early journey with their child. Proprioception and vestibular. Quickly explain to parents as a layman, what are they and why are they so important?
Yeah, so proprioception vestibular. If you look at a child's sensory behaviors, look at their sensory presentation, especially a child who has sensory needs, a lot of the things you will notice and see, whether it's excessive movement, whether it's seeking heavy work, where it's spinning or turning, that's their own best efforts to meet their vestibular and proprioceptive sensory needs. So once you understand a little bit more about these sensory systems, it's like learning to speak a language your child's been speaking since birth. So with vestibular, we call it the movement and balance sense. So if you imagine, if you go on a roller coaster, if you go on a swing, if you do somersaults or even rock back and forth, you're stimulating your vestibular system. And this can have a very organizing and grounding effect for the child. So think vestibular, think movement, balance, moving through gravity and space. For proprioception, we're talking heavy work. Proprioceptors are sense organs in the joints and muscles, and they experience tension, stretch, pressure, and effort. So proprioception, heavy work. So vestibular, movement and balance through space. Proprioception, heavy work. Once you learn to speak and identify vestibular and proprioception, you can really start helping your child.
So if they're rocking back and forward and they're spinning, yeah, they love it. So they're just trying to convey to you that something is not right.
A great example, look at one simple thing I encourage families to have this in most sensory homes is a mini trampoline. Mini trampolines are great, and it's a powerful way to get both vestibular and proprioceptive. If you imagine when they're bouncing, stimulating the vestibular system, going up and down, they're getting pressure through the joints, and their muscles are heavily activated, so you're getting a strong amount of both proprioception and vestibular, and see how the child responds to that, see how positive an experience it is in their day.
Yeah, that is why they love trampolines. Yeah, yes. Every house should have a trampoline. I have it. DK, sensory integration. And when you talk about sensory integration, I just want to quickly tell to the parents, what is the difference between this word, this term that OTs use, sensory seekers and sensory avoiders, hypersensitive and hyposensitive?
Okay. So sensory integration, the word integration itself says what we receive, we integrate it, make sense, and then express ourselves. Okay? Like integrating all different senses and making sure that this is very nice for me and I can proceed further and we can get an output. Now, in terms of sensory seekers, they are the ones they need a lot of stimulus in order to get that gratification level or level of arousal to register it. For an example, I'll say the level of spice you eat might be different than the level of spice I eat. In a normal setting, the amount of salt you would need in your food would be different than the amount of salt I eat in my food, right? Similarly, they have these things that they seek more. What just now Adam said, like, they rock. They do not tell you that something is wrong. They tell you that I need this more. Right. So that's the reason you will see every OT saying that don't stop them rocking, don't stop them spinning, but rather give them a certain activity where they can do it, like put them in a swivel chair, like, let them spin on their own. They will enjoy it. It will be more socially acceptable for everyone, right? And it will fulfill their needs, right? Now, sensory avoiders are those where the sensory system, like this is a vast system, right? We have neurotransmitters involved, we have tracts involved, we have central nervous system, we have peripheral nervous system, we have interoceptors, everything, right? It's a vast system. But the thing is, those who avoid it, okay, the system tells them everything is danger, right? So what happens, it reaches straight away to a center that is called amygdala, which alerts them. It puts them on high alert every time. For example, tactile, the moment they see you coming towards them, they will either run away from there or they will try to avoid it. You will see kids not playing with other kids. They avoid the touch because the thing is they see it as a threat. Now, the contrary to this is I say that, okay, he's afraid of tactile, but still I'm working on tactile. You see, he's tactile defensive or he's aversive or he doesn't like tactile. I still work with him. You'll see most of the OT still working with tactile using different things. Why? Because we have different systems for different tactile stimulation, right? It's not that they don't want it. It's that they cannot modulate it. They don't know whether it is a threat or it is something that is going to help me regulate. So when you gradually hit one system at a time, the pathways get clear. When the pathways get clear, next time it is not a threat for them. But where to start? If he is tactile defensive, oh no, I need to do a lot of tactile with him. No, you don't have to do a lot of tactile with him. You have to do the right tactile for him. Right? Not every, because there are different receptors, receptors for pressure, receptors for pain, receptors for crude touch, a separate receptor. And then there are responses which originate from the spinal cord, which is part of central nervous system, and the brain, right? Whereas the threat which they assume is straight in the brain, right? And brain is the fastest one to respond. Right. So what happens? Those responses which are centrally, located centrally, they are very quick, and they hit the autonomic nervous system where there is exchange of chemicals. These chemicals prevent them from doing anything further, or it's kind of a balance. So it's kind of a seesaw. If you don't have the weight on the same weight on both the sides, it will go either up or down. And that is what is called regulation. We need that seesaw at the center. We don't want it to go high up or high, very low. Sometimes you'll see kids running around, screaming, shouting, right? Other days you'll see him very calm and all. I'll give you a best example. You talked about kids screaming. You will see them screaming, shouting, mostly after an overload of auditory stimulation. The first sign, which I don't know about other, but what I pick is when the child comes into your OT room, because OT is you need to observe the child at every step, right? The moment he enters, he goes for the swing, he's touching the swing, you give him the swing. That's when he knows that, okay, he is overwhelmed with auditory, and that's why he needs vestibular. Why? Because there is a system. There is a semicircular canal, vestibulocochlear system, which leads to auditory and vestibular. Right? That's why you might, as a mom, you might have had observed sometimes kids, they sit on the swing, they want to chew. And what we say, oh, don't chew on that. No, give him something that is more eco-friendly, less harmful. Let him go through that. Why? Because he is regulating. You don't know how much swing you are giving, whether it is hitting too much or too less. But he knows if I chew on this, I'm blocking this. Right? It's similar to kind of regulating our own self. Like if you are overwhelmed with something, you'll just go and have a cup of coffee. But we know that what they know is their way of dealing with this. So this is what it's about, like, whether they should be sensory seekers or sensory avoiders. They should be
That
in
makes
between.
sense. Yeah, I get it. And when we talk about sensory processing disorder, I was told in the beginning that because sensory issues were the first that I picked with my twins. They were gagging, they were not eating, auditory sensitivities. Autism obviously was not in my dictionary, but I was told that SPD, usually sensory processing disorder, is the early sign of ASD. What do you say?
Yeah, it's something it's one of the most common referrals for OT is the child will notice to have sensory differences. So because it's something you can observe, and for socialization and communication aren't as overt and obvious, sometimes as a child who's toe walking or hand flapping or engaging other sensory behaviors, and people see it and notice other kids in nursery or classroom aren't doing these things, and what does it mean? So it is part of the DSM criteria for autism. The vast majority of neurodivergent kids will have some sort of sensory presentation. Now, the issue I have, and what I think is very important, is everyone in this room, for ourselves and our producer over in the corner, we all have sensory preferences. What makes a sensory processing disorder, the D part, is how much does it impact the things you need and want to do? Is it getting in the way of your learning and engagement? If you think of we're occupational therapists. What's the occupations of childhood? Can the kid hold a pencil and kick a football and make a friend and speak to his pal and listen to teacher and do the buttons and wipe their bum and all of these things? They're the building blocks of childhood. Sometimes sensory issues can get in the way of that. They can't go to a birthday party because they're scared of the balloons and people singing happy birthday and it's too loud and too much. They can't go to Dubai Mall because it's too busy and it's too much crowds. Or the parents are worried because maybe the child has a history of running away or a movement that is inappropriate to the context in which they find themselves. It's not that the sensory issue itself is disabling by nature, but in the context, it presents a real challenge. So the more you understand it, and DK, you said something really interesting there. When you talk about the child, when you understand the child's needs, and the first person who understands a child's needs better than anything, it's not the sensory profile, it's not a fancy SIPT, it's the child themselves. And the first thing you need to be is a really good sensory detective. So if you watch the child and see what they're doing, every type of behavior is another form of communication. They're telling you something. And when you learn to speak sensory, then you can sometimes a little tangent, because it's very important that when I do these presentations, for years I've done them for parents, and the one question when I ask people, do you have questions? And people don't ask this, but then at least 6 people will stay behind to ask it by themselves is, will my child grow out of sensory needs? Will it always be this issue? They don't grow out of it, but they sometimes grow into it beautifully with the right support. So instead of sensory processing disorder now, it's sensory preferences. They're still an energetic young man who enjoys rugby, who enjoys movements, who wants to chew gum when they're in college. They still have sensory preferences, but it's no longer disabling. It's no longer getting in the way of the things they need and want to do. So it's very true. A lot of kids in the spectrum will have sensory differences. How disabling that is for them depends on the context and depends on the support they need. They do need support because otherwise they'll spend years. If no one around them learns to speak sensory, they'll do their best to figure it out themselves. And a lot of the things like chewing shirts and rocking, and I have some very atypical, can be shocking sensory behaviors, and some of them can seem aggressive or self-injurious, but that's the child's best attempt to figure out their own sensory world themselves. As soon as you and the people around their child learn to speak sensory, you can literally, like a bell going off in your head, like light bulb moment, you can think, I hear you, kids. I understand why you're doing that thing that seems shocking to everyone else. I get why it's important for you to meet that sensory need. And now we can work together to get somewhere better.
You use the term sensory preferences. I love that.
Yeah.
It's amazing.
And we all have it. I've done hundreds of sensory profiles, literally. In my whole career, I've had one individual who was totally vanilla and was like right down the middle, one person. And that's unusual in itself, because some people, like, I'm a massive sensory seeker, and God bless her, my lovely wife is very sensory sensitive. So I think I'm great, whereas I'm probably bothering her quite a bit. Seekers don't always notice people around themselves.
Exactly.
So it's understanding your child, and for the child as they grow, understanding themselves.
Yeah.
And then you can, it goes from sensory processing disorder with the right support in place. Those sensory needs, your brain is your brain. You've got what you've got, but it's no longer debilitating you. It's no longer holding you back.
Exactly. That's the point. Very well put. Yeah.
If you won't mind, I'll set this one in a very short example. Like a newborn, we feed them, right? As a toddler, they try to eat, we still feed them. When they grow up, okay, they know where to get the food from. They can sit at the table and eat on their own. Same thing goes with sensory processing, right? Or sensory challenges. Those who do not understand what is this, right? We need to provide it to them. Then they will ask you, they'll communicate that, okay, I need this one. Can I have this one, right? And then you give that in an appropriate manner at an appropriate level so that they understand that, because sensory seekers do seek a lot of sensation that may calm them down, right? But at the same time, don't forget, it may overwhelm them, right? So we have, that's the reason just right challenge that is very oftenly used in OTs, like, just right stimulation, right? To bring them to that level and then proceed further. So as Adam said, like, is it going to stay for the whole life? Well, we all manage our sensory regulation in our way.
Yeah.
Well, I would like to go to a concert if I'm stressed, right? Somebody else would like to stay in a calmer place. Maybe he'll end up on a beach.
Preferences.
Right? So these are sensory preferences, and they then understand at that level what would be the best thing for them, right? So we should never get bothered by someone having a fidget toy in his hand and moving it. Well, it's his way, right?
Regulating,
So
yeah.
it's
I get it.
it's all about
they learn with time.
yeah. It's all about how do we tackle our own sensory needs.
Well put, gentlemen. Very well put. Like, I have lived it. They have gone better from where they were at 2, my twins. Lots of sensory issues, but now I know that they have adjusted. They know when to pick up their chew tube and bite it. And
Yeah. Do you mind me asking, how old is your child now?
they're 11 and a half.
Oh, fantastic. Oh, this is perfectly timely then,
Big boys.
because it's always a moving target. It's a work in progress when you're working on young person's sensory needs, and you're always working with them. It's like I say, the sensory language, your language is always expanding. You're developing your sensory vocabulary. This, you'll understand the child, their sensory presentation changes through childhood. Then they get to puberty, and everything goes a little bit bananas. Because if you imagine the sensory system, any child going through puberty, you're experiencing the world more intensely than before, and you're going to have a period where your sensory presentation is slightly dialed up, like the volume dial gets dialed up a little bit. So having sensory supports in place before this, the things that worked previously will still work, but you might need to just do a little course correction, a little readjustment and expect... There's some stuff going on in that brain right now, so it's natural to have a little bit of a wobble.
I'm scared of teenage. They're 11 and I'm just looking forward to teens. But I hopefully will manage with the right OT.
Yeah.
My next question is related to this toilet training. I am sure you have heard about it. And as many parents that I have seen, they have kids 12 years, 13 years in diapers.
Yeah.
And they're like, we don't know what to do. So just quickly, I just wanted to ask you, Adam, from an OT's perspective, what do you think, why children and parents struggle with toilet training and interoception? What's the role of it? Like some parents say they don't even know that they've soiled their pants.
That's very true.
They don't understand. So what is that factor that's missing in toilet training with parents who have older kids now?
Yeah, it can become, there's some people ask sometimes, you have something like toilet training or cutting hair or cutting fingernails or something that can have there's an aversive nature to it where the child builds almost like a fear response, or they're really nervous, or this is a real sticking point in their development, and it's like they have trouble getting past this one issue. Sometimes there is like a learned aversion, like a negative association with it. Maybe they had difficulty going to the bathroom before and this was forced upon them. Or it was really, it's like a very, not aggressive, but a very direct approach that this has to happen. And the young person, because especially for sensory kids or neurodivergent kids, control is a massive issue. Control, this idea of being forced to do something, and then kind of standing their ground and having this fight or flight neurological response. Their brain is telling them, no, we cannot do this. It's panic stations. You're not going to rationalize them through it when they're in that emotional state. So then it's building associations. People ask me a lot, is it sensory, behavior, or psychological? Yes. All of those, all of the three. And it's also, you can build in big habituations. A good example is, God bless him, DK. I don't know if DK, do you have kids?
I do, yes.
Yes.
I'm
So
blessed with one.
the dads I work with in my trainings, God bless them, but the dads are usually the culprits here. I'll have a young kid. This has happened so many times, whether it's potty training or haircutting's a big one, and the kid does not want to get the haircut. Will fight tooth and nail. Anyone goes near their hair with clippers, and the dad will say, he looks like a girl. He's getting his haircut today. Holds him down, buzz, 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 and shaves his head.
Yeah.
This has happened several times
Yes.
in my experience. Do you think this kid will have a positive association the next time anyone goes near their head with clippers again? And can you do this when this kid is 17 years old?
Nope.
No, you cannot. So it's how you approach that situation. I have a little framework I use for educators and teachers and parents for any activity to be fun, clear, and accessible. If it's missing one of these three, it's likely not going to be successful. If you're very fearful, it can't be fun. So even building just normalizing the experience. If it's in a specific context, like they really don't want to use this bathroom, you can do it in a different bathroom in the house. Don't even worry about going to the bathroom first, but building and making it less fearful, less aversive, and having positive associations around bathrooming. Then clear that you can use little Carol Gray style social stories. There's lots of templates of how to approach this issue, whether it's haircutting or toileting or fingernails or anything like this. And then accessible, you're not engaging that fear response. You're keeping the emotional equilibrium nice and low. And if it doesn't work today, that's fine. This is not something you're going to just win in one day. It's a gradual conversation. It's never over. So if I've had families who are in their teens, you can still revisit it. You can still go back and you can still make progress, but it's how you measure success. Is it just a little bit better than yesterday? That's still success.
Yeah. Well, last line that really hits home. It's a very slow process and you have to be really patient. I think toilet training in autistic children, neurodivergent, it requires patience.
Yeah,
and
yeah.
it's a slow process.
And it's the thing for parents, I find, and teachers as well, the stressful element isn't the behavior you see, or it's not the challenge that the child's presenting you with, is that you as the adult feel like, I don't know how to help this kid. What am I meant to do in response to this situation? Whereas if you work with like an OT or you work with a professional and they're able to guide you and say, in this situation, this is how you respond. You're doing a great job. This is how you do, and it's totally fine. Then, because there's a lot of guilt that's associated with it as well.
Yes, and social pressure.
Yeah, and I have parents. There's a reason I have a box of tissues in most of my consultations because tears are very, very common. And this is part of the process. And feeling like you have, because in Dubai in particular, perhaps you're removed from extended family. You don't have those social safety nets you might have elsewhere. So having that little bit of reassurance and then guidance of, in this situation, this is how you respond. We're here to help. And this is what the best thing to do in this moment with this child. That's a positive experience for you and them.
Yeah. Beautiful report. And DK, related to this, the biggest concern, another one, is screaming and shouting, because I have seen kids, they're scared of loud sounds. This is the common picture that you see.
Yes.
But there are moments where they'll just scream and it will be so loud, and sometimes it's socially unacceptable as well, and sometimes it creates a problem in schools as well. What are the emotional triggers? Sometimes I just look around and I'm like, there's no reason why is he screaming, but it gets really loud. And since I have twins, and sometimes when the other one is screaming, the first one will be like, oh my God, it's so loud. And I'm like, excuse me, like you were doing the same 5 minutes back. So what are the triggers behind screaming? And how, do you divert it? You let them be, or you just stop them? Like 90% of the parents will like, stop screaming. Like this is the most common line used in our houses. Stop screaming.
So when you hear someone screaming on top of his voice, okay, there can be multiple reasons. Okay, first thing, if the child does this very often, it is very sure that he gets auditory overwhelm very quickly. He has a low threshold. He is sensitive, right? Why do they scream on top when somebody else is screaming or when something is going on around? That's the anticipatory behavior. Or, when you want me to be heard, I'll go louder and I'll block the other sound. That's called auditory blocking, right? So they go louder than anything else. In kids with auditory processing challenges, they can hear everything. They can hear someone talking in the other room, right? They have got like, this level of, I wouldn't say sensitivity, but alertness. Now, this alertness enters into fear, right? Because, oh my God, the balloon is going to pop. The balloon is going to pop. This thing releases cortisol, which is an element which will, kill all the happiness around in there, and they will enter in a lion's den and they would want to go out. Right.
Yeah.
Now, in that situation, in most of the situations, we suggest, when you know that he's going to attend something, prepare them, have an exit in any sensory, like on any sensory system you're working on, say vestibular or tactile or say auditory, have an exit. When you do not have an exit, you get blocked, you will be afraid. If you don't know where is the exit to this room, you will be like, oh, okay, now I need to go. Now I need to go, right? So they should have an exit, right? Keep the things next to them. You can have a communication. This is the way the child is communicating that, okay, this is too loud for me. This is too loud for me. I cannot take it on. So there are things where like sound blockers, you've got noise cancelling headphones, right? But the thing is everybody thinks that it's a stigma. I'll touch in Adam's conversation about toilet training. What do you think? How is the sound of the flush? Is it good? It's bad? Sensory preferences. I do not like it. I do not like the jet spray. It's hitting me tactilely. It's making so loud sound. I do not like it, right? Most of the times, we forget about toilet training is the height of the seat. Somebody who has challenges in vestibular, somebody who has gravitational insecurity, do you think he's going to sit on that seat? No ways. How can you expect him? Because his legs will be in air and he'll be constantly like this. He won't pass because that will trigger a stress response. When you have stress, you constrict. You become stiff. When you become stiff, instead of passing it, you pull it in.
And you want the exit.
Exactly. So the thing is making the environment comfortable, what has been focused, okay, is the key in any area. Even in auditory sensitive kids, there are auditory seekers, okay? They'll keep on singing, They need it, right? And it's not that those who are sensitive do not want to hear. They want to, but we have a range within which we can tolerate. They have a shorter range, right? Second thing, mostly I have seen this with parents, supporters, even therapists. If he's not listening, we talk louder.
We raise the voice.
Right?
Yes.
Well, no. Next time, go to the child, whisper. He will listen to you. Just whisper. If he won't listen, at least he will look at you. It's all about registering what you're saying, right? It does not matter how much force I use. If I put a gallon of water in this glass, okay, it will fill and spill.
Yeah.
But if I hold the gallon appropriately and pour it slowly, it will fill. So it's not about how louder you can go and tell him, no, do this. They read your facial expressions. If I come to you like this, you will feel threatened. I will run around. Now you chase me. What happens in this chasing, you will see kids, they love being chased. Come on, come on, right? Yeah. They say, oh no, he's teasing me. He's not teasing you. You are actually helping him to release serotonin, which is a happy hormone. Oh, I'm liking it. Now chase me, come on. And then they lie down and you'll pull. When you pull, you get the probe. When you get the probe, oh, this is my hand. This is my, come on, do it more. Okay, and lie down again. So it's more about understanding their right need. See, any behavior has a reason. It cannot come up without reason. I cannot get mad at anyone, without anything, right? For them, the reasons is we need to find out whether he is overwhelmed, whether he is understimulated, Okay, what's going on in there? Find the reason and treat the reason. Don't treat the child. Okay, if you won't do this, I will not give you this. Okay,
I'll just cut you here. And one more thing, that the behavior that commonly we see is
flapping.
hand flapping, clapping, and usually what parents do, stop
it.
Yeah.
Like, and I have a friend, her son really, he's like, I get tired looking at his hands. So she'll give him something in his hands to keep him engaged. He will do it with that thing in his hand as well. And it's what do you do in those situations when it's socially unacceptable? And it's like, even with rice, he's doing it, and anything given in his hand. He's one of the strongest examples that I've seen. What do you do in those situations when it's, it's...
Yeah. Now, there are two situations in this. Okay. Either he is seeking, now what we see is that he's seeking visual, right? But visual is not the only thing that he might be seeking. It might be a vestibular that he's seeking. Why? Visual and vestibular goes together. You will observe this in most of the kids. Like, when they sit on the swing, you swing them and then they look at you. Rest of the times, they'll be like, who are you?
They're zoned out.
Right?
You look at them and you're like,
And
what are the
then
things?
when they're on the swing, they look at you. Why? Because they get that vestibular and ocular control. Now, when somebody is try doing it. Like, I always tell these parents, try doing this in front of you. It stimulates you, right?
Yeah.
It gives you dopamine, right? Okay. Dopamine is something that is very, I would say addictive. Okay. And that's the reason when you get a child on screen, you will always hear from OT, limit the screen. We don't say take it out, limit the screen. Why? Because when something is addictive, next time you need a higher dose to get to the high.
Yeah.
Right? So in this scenario, when they're flapping or doing this, okay, you first need to find out, the therapist needs to first find out whether it is a visual, vestibular, or it is overstimulation. Second thing, probe. Most of the kids, they'll keep banging, hitting, okay? They need to sense their body, right? So if you try to give a heavy pillow, you might have heard from a lot of therapists, give him some heavy pillow. When I say heavy pillow, not 1 kg. No, that's not heavy. 5 kg, 7 kg, 10 kg, how much he can tolerate as per his body mass, right? Give it to him, okay? Try to get him into a lot of squeezing. Then he'll know, oh, okay, these are my fingers, okay? And this is what I am processing. Give them stretchy stuff, okay? When you give them stretchy stuff, it gives them tactile and probe at the same time.
They make this face when they are stretching.
Yes.
With my sons, I can see that they love it. Like,
Yes.
it's something coming out.
And you will
With
see
that
them
face.
always trying to see the things for right? They will throw things and you're like, oh, why are you throwing those? You should not be throwing things. Most of the times when they throw the things, it's both visual and probe. They love it. They push someone.
Oh, I just
and then
got my answer.
go
My son
and-
has this habit of throwing things from height, from first
Yes.
floor to second. And then he looked down and he has this weird smile on his face.
You know why? When you move your head up and down, there's a vestibular system that gives you the sense. When they stretch their arms and go, woo, you will see them bending their neck in different positions. Keeping it like this, or putting the head down and running.
Yes.
Right?
I've seen that. Yeah.
This is positioning of the vestibular system to get the maximum level of pleasure they can get from that. Right? Now, the thing is should we stop it? And it is inappropriate. I don't see it appropriate to be done in this setting, that setting, home. Right? If you fulfill this need in an appropriate setting, using an appropriate equipment, as Adam suggested, I love it. Trampoline, yes. Some of them, they think oh, okay, if I have a trampoline, let me put it in the backyard. Is it accessible to the child? Right? So position of few things, that matters as well. It's not only about, okay, this system is not working, let me work on the system. But how would you help? As I said, how would you help that child to reach to that need on his own? Accessibility, how accessible it is.
Yeah.
And that's the reason we always say, oh, use a wobble cushion. Why? Why do you use a wobble cushion? Nobody, oh, okay, it helps him regulate. How? It gives them vestibular and probe.
Yeah.
Okay? At the same time, the spinal reflexes, right? The posture, right? It helps them. They keep on moving. You will see them like doing, and as you said, like, when you do, okay, that's the quick shot of adrenaline they get when they see something that is very good for them. Now, how would you express, like if I say, oh, now you're setting, you've done a competition, and I say, I announce your name. The moment you hear your name,
Yeah.
this is what they feel. This is what they feel. And when you ask them to stop it, well, you're doing a crime. You're actually preventing him from enjoying what he is actually looking for, right? And a well-regulated child will always have a source. Okay, he will always seek a source from certain areas and self-regulate himself. And that's the reason, like, you might have heard from many OTs, like, keep a toy, sensory toy with him, right? A squeezy ball, or maybe a stretchy thing, or maybe a chew tube or something. Why? Because that is something like, where they are stuck in and they need to grow out of it, right? Now, biting, it is not only tactile, it's the joint, temporomandibular joint, right? The harder you bite, you get that deep pressure, right? And that is proprioception. Now, proprioception is the referee between tactile and vestibular. Too much of vestibular, oh, okay, give him probe, settle him down. Too much tactile over him, oh, give him probe, settle him down, right? So he's a kind of a guy who will decide, oh, okay, he needs this now because he's too much. That's too much for him. And when we talk about happy hormones, okay, there are other neurotransmitters, okay, they actually reuptake them, right? And the thing is, like, they are daredevils. They will, like, see, if I give you one thing that made you happy, like, 10 things that made you happy, one wrong thing can ruin your whole happiness and put you in a situation where you'll think, oh, okay, my day was bad. Why? It's all about neurotransmitters. It's all about what I love the most. And that's the reason when the child is feeling, oh no, we give him this one, and then he is like, he does not attend. He's like, his attention is gone. Well, if you take it away from them, okay, what will happen? They will curse you. He's not a good guy. Why did he take that away? If you think that he is not attending, keep it in front of him. Make sure, gain the trust that, oh, okay, it's right there. No problem. It's right there. Let's get this done. If you think, do not plan the activity in your head as per your needs. No. You are doing everything for the child. Think of his needs. Oh, I've got 5 pegs for him. He needs to put 5 pegs. No. He just needs to put 2 pegs with happiness. DK, I did it.
Yeah, don't push
Finish,
buttons.
right? If he doesn't do the 3, you can try. Oh, come on, do one for DK. He might do it only if he has serotonin. You will do extra work in your office only if you are heightened, right? You will stay beyond 6. Ah, okay, it's fine. Today I'm happy. I'll stay here until 7.
That really happens.
This is how it works with the child. And the thing is, like, only looking at the child by his mannerism or his approach toward an activity, okay, that's not we should actually do, right? Because most of the times, like, parents say, oh, okay, he's holding the pen like this. It's okay. At least he's writing. That's legible. Yes, it is good. When the child goes to high school, okay, if you won't shift him, he will start his own correlation. He will look at his friend. Okay, he's got better, right? Then comes the stress because comparison starts. They compare, right? So it's very complex to understand about a child. And even in psychology, they say the best assessment is observing the child in the natural environment. It's not, as Adam rightly said, it's not about the tests. It's not about the things. How can you justify a child in 1 hour? And how can you say that you have maintained the standardization of a standardized test unless and until the child meets the minimum criteria for it? Right? So it's not that everything has to be done through a standardized thing, because if I have to do a standardized test on someone who I already see that, okay, he has triads of ASD,
Yeah.
it's my bad that, okay, I am still using the standardized test. It's my knowledge. Oh, okay, dude, you shouldn't be doing that because he's going to get overrun. And then you will see more of those things
Yeah.
than actually you should be seeing. So you need to first identify where he stands exactly and then proceed further. You cannot just do things just because it is said in theory.
Yeah, right. That leads to, we're running out of time, the most important questions of all that I had. Primitive reflex therapies, it's the it thing right now. What is it, and why it has gained so much momentum just recently, and how does it work?
Yeah, I have a bit of it's a bit of a polarizing one there because it has become massively in vogue and it's been used by OTs for a long time as part of an overall kind of assessment approach. Anything that becomes kind of proprietary like this, like primitive reflexes, where it's seen, I think it's not that it's oversold or overpromised, but people, especially with things like neurodivergence, and especially with things like autism, people are looking for a solution that will kind of fix everything. And it's a guideline. It helps us as kind of detectives when we're looking for signs of the way the child is processing information, the way they orientate their body, their natural evolution through their developmental milestones. And that can give us information for, you look at ATNR, you look at different reflexes and how the child's developing there. I do find sometimes primitive reflexes are oversold, as in you have families who are putting so much faith on this being the thing that was missing this whole time. And we see this not just in primitive reflexes, but we see it in other areas where it becomes that, oh, this is the new breakthrough that will, and here's the kicker, that will cure your child. Anytime you hear this expression, massive red flags all over the place. And this is the worry I have with something like this. It's a useful guideline. It's a useful element for investigation as part of a broad assessment. It's not the missing massive piece of the puzzle that I think it's sometimes oversold as. Like, for example, there are sometimes areas that are
To me, I'll just cut you here. What precisely is because it's being sold so fast to the new parents?
Yeah.
What exactly is it in two lines? And should all parents go to it? Because everybody is just falling for it.
Yeah, it's not difficult to kind of, when you can, it's pretty useful to be able to Google it and find some good references, and you'll get some good information about what this is. So every child goes through developmental milestones when you have, as it says, primitive reflexes. You have reflexes you have as a baby that are appropriate to that level of development. Then if you imagine the elements of neuroplasticity, so the child's brain is making new neuronal connections and going through different stages of development. So you have rooting reflexes and Moro reflexes and grasping reflexes you see as a baby. Then these naturally fade away into the background as the child progresses through the developmental stages. Then sometimes you find, and people point to it as in, okay, this level of neuronal development, it's like the roadworks haven't totally finished. They got stopped, and the kind of construction workers didn't finish that part of the road. So there's a little bit of a pause in that element of the process. And it could affect things like the child's body awareness, the child's bilateral integration. These things can have an impact on their occupational performance in the classroom, out and about as well. So there's exercises you can do that will definitely help working in different body positions. None of it is rocket science. It's not hugely complicated. And you'll get a lot of this from integrating into natural age-appropriate experiences. My issue with things like reflex integration is they take away from two most important aspects of developing skills in general: opportunity and motivation. I might have mentioned before we were talking here about the thing I do with pedometers with my kids sometimes. I'll have a family come to me, say they've got my name from somewhere, seen some of the radio stuff, and they'll say, okay, he needs OT 3 times a week. Let's get to work, and this is expensive. We're going to do everything we can, but I'll give the family a cheap pedometer from like a dollar store here, like Daiso, and get them to wear it for 3 days, and they'll come back to me. And the pedometer says 2,000 to 3,000 steps a day. The child's not moving. They're not getting the natural, age-appropriate opportunities for play and development. At any child, right out of the box from birth, is a machine made for learning and development. If they get the opportunity and motivation to do so, if they get there's not sensory sensitivities holding them back from exploring and rolling their sleeves up and getting involved in things. So you need natural, age-appropriate play opportunities, chances to move, chances to just be a child. If they're not getting that, there's no proprietary treatment approach or no therapeutic approach that's going to overcome this shortfall in natural play experiences. So that's the thing. It's kind of like another way, because I came from like a fitness background years ago, and you always had people thinking, what's the supplement I'm missing? What's the ab exercise I'm missing?
Yeah.
So I'll look like this guy. The best advice is the kind of boring stuff about balanced, healthy diets, fruits and vegetables, moving, calories in, calories out. Developmentally, you want to make sure the child is moving, the child is sleeping, the child is engaging in developmentally rich experiences every day. Those are the non-negotiables. Then there's elements like reflex integration, like sensory integration therapies, like anything. If there's a barrier to that child engaging in any of these areas of natural child experiences, childhood occupations, then those can help overcome them. That's my only concern. I don't like throwing shade in other treatment approaches, but I do think it becomes anything that becomes the in vogue thing. We do have to look at it with just a level of insight.
And another question right connected to this is, you have done therapies for years and years, but parents will come to you and say that there is this restlessness in the child and the hyperactivity. Like, I go to the OT session, he calms down for 2 hours and then he's back to it again. And there's excessive energy. I make him walk 5 kilometers, but he is still so hyper. He's jumping, he's not sleeping, he's not giving me, there's no visual engagement. He's not looking, I'm giving him the cards and he's like, visual engagement. And when is the point where you decide that I am done, this is time for medical intervention? And that is, I've seen parents have recently started doing it for restlessness and hyperactivity, because they're saying that, you run out of finances as well, because OT is expensive, I'm sure you'll know.
Yeah.
So what do you think, how long should parents wait before taking this big decision? Because medical intervention is, to me, I've not done it because I'm scared. So
Sure.
as an OT,
It's part of the OT's kind of job, really, to know not only our job, but know other elements of the process's job. Because sometimes OT, we could be one of the first people parents connect with, because we seem like the friendly neighbor. It's not that scary. We do nice, playful things. But in reality, OT intervention is medical intervention. We're medical professionals who go to medical school. And it's a false dichotomy. And people think when they move towards therapies or psychology or neuropsychology, a good colleague who does amazing work in neuropsychology, it's almost like admitting defeat that therapy didn't work. They get to a process, they do so much in therapy, and they think, you know what, it's not enough anymore. Let's speak to the guys in the white coats, and let's go to that conversation about psychopharmacology, about different medical interventions. It's not an either or element. In fact, when they work best, because I come from a CAMS, child and adolescent mental health background, it has to be in synergy. So I might have a child, this is a very common one I work with now. I'll have a kid who comes to me with sensory issues, and people think, hey, this kid's really anxious because of all his sensory needs. Perhaps, but that's a two-way street. You might see a lot of sensory presentations because of his underlying anxiety, and he's so anxious in fight or flight all day long. So if I work with someone like a neuropsychologist, if they can reduce this child's anxiety, it opens the door for the access to my sensory interventions and learning the child's doing in the classroom. So a truly holistic treatment approach has to accommodate these different professionals and working in synergy together. Not this guy in this office who doesn't speak to this guy in this office.
teamwork.
The thing I hear from parents so often in Dubai is they have to go around the city and pick up pieces of the puzzle here and there. What we try and do, what it should be done, is the parent comes to us and feels supported from the get-go, and we give them all the pieces of a puzzle together. Sometimes they'll come with a whole box of pieces. This is from a totally different puzzle. This doesn't even fit with the rest of the pieces. And the parents feel totally lost and all at sea. Whereas when you get professionals working in collaboration and mutually supporting one another's goals, that's beautiful. And the parents really feel that. So there's never a point where they go, you know what, let's do this instead. It's a constant conversation that evolves and grows with the child. So as a parent, you feel supported every step of the way.
So are you trying to say here that it's better to go at one place where dots are connected, where therapists are connected, and it's going to work better.
100%. And you should never feel as a
Well, I
parent
disagree.
that you're being asked to jump into something you don't understand. Some parents, there's a bit of another thing where some parents are too quick to trust authority and some have no trust of authority at all. In Dubai, it's a bit of a funny one because I never thought coming, because UK, they have the NHS. In Ireland, we have a thing called the HSE. Has a lot of like flaws and stuff to it as a service, but it's somewhere unbiased that parents can turn to get advice where they're not being sold a thing that they're not sure about.
Yeah.
This central authority is harder to find here. So parents, what do? They ask other parents and they go on comment boards and they go on like Facebook groups and stuff. And it's great. You need parent support and other parents, but you do need to connect with a professional in that area of practice who you really trust and get the impression, go visit them and speak to them and see from the information they say, do your own research and then think, okay, what are they recommending? Look on Google Scholar, and it's not impenetrable. ChatGPT can help for things like this. If you're not accustomed to reading clinical medical articles is tough sometimes, even if you're familiar with it. So go on ChatGPT and ask, what is the evidence base for this for a child this age? So do that. You have that tool available to you. And then think, okay, how do I feel about this? Be candid to the professional about what your concerns are, and they should be able to answer. They shouldn't be defensive. They should answer your concerns in an accessible way, and then see how you feel moving forward. Doubly so if it's something you feel is invasive. If it's something you feel it doesn't feel intuitively right, start low, go slow. Make sure you feel supported every step of the way, but they're all just tools from the toolbox, whether it's psychopharmacology, whether it's OT or speech or neuropsychology or TMS or there's lots of very exciting new treatment innovations, but they're just tools from the toolbox, guys. There's not one thing that's a magic pill. It's how these pieces of the puzzle fit together.
Together. Perfectly. I love that answer. And DK, to the last few questions, usually OT will tell you, like you mentioned earlier, screen-free environment and sensory development. But twins like mine, kids like mine, who are dependent on a screen for communication, and sometimes I have to put some games, and sometimes I have to give them YouTube just as a reward, or, do you think that because this is also another thing that virtual autism screen is creating this problem. New parents are still, I don't believe in virtual autism, to be honest. I don't know how much bash I'm going to get about this, but do you think screen-free environment is a plus in sensory development or no?
The thing is it's a dual-edged sword. It has two edges. It's up to you how to use it. Like imagine you're driving. What is more important for you? For your child to settle and be in the seat and know he is not in a good mood. Give him a digital thing where he can play around, okay? But the challenge here is what I see is not using the digital. But the thing is, you're just giving them when they scroll, they just go. It's an instant gratification. And as I talked about dopamine, the more you take, the more you need it, right? So for them, it is again the sensory and instant gratification without any efforts. Whether if you have games, it is much more interactive and it highlights different areas of the brain rather than just watching that ball falling off. They will look at the spirals.
Yeah.
They will look at those,
And keep pressing
I've
it.
seen this game. Yeah, okay, he's flying.
Yeah.
It's kind of like a virtual thing which blocks the vestibular. I'll give you a simple example. If I put a VR on you and I play a roller coaster, you'll still scream.
Yeah.
But are you actually in the roller coaster?
No,
Why do you scream?
I'm scared.
Why? That's where the neurology comes in. That's where the autonomic nervous system comes in. Your optical pathway, which is connected again to the vestibular and thalamus, tells you, oh, dude, you're falling. Oh, no, scream it loud.
Yeah.
That's why it is called VR, virtual reality. It's not the reality. Now, let's talk about the reality. You sit in the roller coaster. You take a deep breath. You hold it. Why? Because you are just creating that little bit of acetylcholine and adrenaline, kind of balance to make sure that, okay, you're ready for that. That's the first sign. Second, whoosh, you go, you feel the push. Okay, that's what is it? Vestibular thrust.
Yeah.
You go down, you feel the interoceptors. Why do you feel that
Butterflies in your
butterfly
tummy,
in your
yeah.
tummy when you go down? That's your interoceptors, because the things in your tummy, all your organs are moving, and there is only one nerve, vagus nerve.
Yeah.
That now is like, very famous. There is a theory on that as
Yeah,
well.
yes.
So the thing is like, it's more about how you experience it, right? Rather than should we give it or not. Now, in a scenario where you have got n number of options, okay, you are in a garden, a park, maybe your backyard, why would you want your child to have a phone on it? Right? Second thing, well, I cannot take it off. What should I do? Make him sit on a wobbly ball. Let him do it. So you give the natural and the virtual at the same time so that he doesn't forget the other one. Right? Now, we are all lazy. If we get something very easily, we will opt for that.
Yes.
We don't want to work. This is the biggest fear, because then they miss out on the real experiences. Right? How on real experiences? Same thing. Like, we'll come back to the thing which Adam discussed very nicely, like, reflexes. What are reflexes? They are then automatic responses. You don't have control on that. No, you cannot.
Yeah.
Right? So these are the automatic responses that comes from the brain and the spinal cord. They are protective mechanisms defined to prevent the child, right, when they are too young. They should all integrate by 18 months, right?
Yes.
Now, if the child will not grow out of these reflexes, he will always have the challenge. And the biggest challenge, you can observe a child, like, those who are seeking, okay, or those who tumble a lot, you'll see them jumping like this on trampoline, one hand straight and one hand bent.
Yeah.
Right? That STNR.
Yes.
We don't do the assessment. You have to have keen eyes to understand. Yes, it is very important to work on reflexes because they are automatic responses. They are not voluntary. These automatic needs to be turned into voluntary. That's why you cannot deny coming out of this, but that is not the only thing. How do the reflexes come? With a stimulus. Right? You try to put the child back on his head.
Yeah.
He will startle. Like, try to make them sit on the ball and push the ball. They'll cling to you. They'll hold you. Now, hold that child tight in your hands, okay? By the way, this is called like therapeutic use of self, right? Hold the child, hug him tight. Oh, come on, let's do it together. And then you rock with him. He'll be as settled as he could be.
Done that. Yeah.
The reason you are actually, you remember the referee proprioception? That kills the fear. Oh no, I have an assurance that this guy is there with me and I'm not going to fall. Okay? This is how slowly and steadily you need to work on systems which are interconnected. You cannot say that only working on reflexes will help him. No, but why are the reflexes? Dude, it needs sensory stimulation. It needs some sort of stimulation to. Why would the child open his palm unless and until you stroke it? Why would the child move his head unless until you stroke on his, outer part of his lip? You are giving him tactile stimulation, right? That is sensory.
So then when the people who are pro iPads and pro these poems and, Cocomelon, and they say it also helps them regulate. What's that science?
Yes. Now, let's come to this. As we said, it is all something that you're getting from digital, right? You can go and Google this. The maximum number of, I would say, heart problems in general terms, you'll see increasing in the IT sector, those who are confined to the screen and the table. It's not because of the screen. They don't get to move.
Movement.
Right? Second thing, how do they get this then? Oh, they watch movies. They play games. That's dopamine. More they play, more they get. Now, what happens is when you have one system overriding the other, it blocks everything else. right? And you only realize that, oh, okay, now I'm getting weaker because once the lift was off and I couldn't climb 20 steps. That's when you're like, oh, dude, I look healthy. Why can't I do that? Ask yourself. That's why they say keep moving, take break, right? And this comes in adult OT. So it does not come in pediatric. So the thing is, screen, when you use it, you have to use it wisely. You cannot completely stop it, okay? Because it is something that helps you. But always have some sort of motor factor in it. You have to have a motor factor, right? If you won't, even the switches, move the car, oh, okay, they are getting something real rather than just watching the spinning wheel or like different sounds kind of thing, right? And the thing is, like, when they have some sweet spots, right?
Yeah.
They will like one certain sound. If you go, like, I'm not sure, like, when you do an assessment for auditory processing, or when you observe a child for auditory processing, you will find a band within which he likes it.
Yeah.
Right?
Yeah.
They will only, like, check the rhythm of the music he loves. It will either be fast or slow.
Yes.
It
I've
will
seen that.
never be a mixed one.
Yeah.
It will always be either fast or slow. Well, this is what happens, like, when you are trying to integrate something into someone, okay, you cannot have an open hand to something that you want to stop, right? So it has to be always a mix. If you let one thing override the other one, you will never have that experience, right? Now, it's more about us thinking about whether this is going to help my child. I cannot take my child. He wouldn't want to leave the iPad,
Yeah.
right? But the thing is, like, okay, take the iPad, no problem. Let's do some marching. Let's do some jumping. Let's play a pillow fight. Okay, you get the iPad, no problem. Take it. Put him on a swivel chair. Okay, you get these very nice chairs. This is for the first time, and, like,
one
I've
that
seen the
spins.
chair. It rocks and spins. This is one of the most important thing that a parent should have in their lounge or in their hall or wherever, in the living room, not
In
in the
their reach.
bedroom. Why? You need regulation when there are distractions. You don't need regulation when you're alone,
Wow, that's a good point.
right?
Yeah.
So that thing, trampoline, amazing. Vestibular and probe, right? Now, even in vestibular, when we talk about the systems, it's linear, circular, mixed. Okay? So when the child bends his head, he's actually trying to experience the other one because he needs that one, right? It's like, pink. Which pink you want, dark or light? I'll go with the light pink. Okay, no problem. So defining these systems in reality and in virtual is very important.
Yeah.
You cannot have the feel of the breeze when you go on the roller coaster when you're virtually doing it. You cannot have those butterflies to the extent you get in the real roller coaster. You don't get that visual input in your eyes that you get in the real world. When you're actually doing the roller coaster. You don't get to move your head, okay, and see, because in VR, you just look like this. You go back and front, okay? You don't look around, right? In the real roller coaster, you hold somebody else.
Yeah.
You squeeze them.
Yeah.
You look here, oh, how is this looking, right? So these things do matter because we need sensory integration, feeling breeze, touch, squeezing someone, holding the breath, right? Probe, right? Serotonin, adrenaline, a lot of things, right? In virtual,
No.
just the optical pathway, right? And the elated state after a real roller coaster, which gives you dopamine, serotonin, all happy hormones at the same time, lasts longer than the virtual.
Very well
You can
put.
try it.
Yeah. Yeah. I get it. Real is better than virtual. Adam, for any particular reason, if a family is not cannot take occupational therapy, and you know many families, I'm sure. What is that ideal setup in the house, or what are those necessary things that you think these 4 or 5 things, trampoline, a rocking chair, and what are the activities? Once I messaged you, I remember I put up a question in a live show that you were doing, and you said if you can't do any activities, swimming. And I took it to heart. My kids were aquaphobic, for anyone who doesn't know. Even a visual of water will trigger them. I took it so seriously. I used to drag them to the pool. I took them to a very, very nice pool here. And first week, everyone is looking. I'm coming with 2 kids like a monster. I'm like, no. And the coach was very nice. 2 years in the journey, they swim like fishes and they love it. The way they sleep after a pool session. And it really worked. And, I really wanted to thank you publicly. It's really worked. So what are those activities that parents can do who cannot take OT? And what is a main, not very expensive setup or things that they can have at home?
Oh, good. Well, firstly, I'm very glad that was successful. That would have been very awkward if you said that was a terrible bit of advice and it didn't work at all. So, yeah, there's so much you can do yourself. The first thing I would say you want to do if you're a parent I get lots of parents who reach me through social media and geographically or financially or whatever reason, they don't have access to therapies. But if they reach me on social media, they have an internet connection. So the best thing they can get is information. So their own education as parents, and there's so much out there. Message me, find me on social media. I'll give you a list of recommended reading. Google's not always your friend because you'll get too much information, especially in anything like neurodivergence. There's so many competing opinions. There's really, really good text and amazing parental resources out there, whether it's free online trainings for yourself as a parent, because you're not an expert maybe at the beginning of your journey about primitive reflexes or sensor integration or vestibular processing. You're an expert more than anyone else in the world on your child. So being able to apply those skills to your child, there's certain things that are generally very valuable. Swimming, the reason I do swimming, it's kind of like the Ne Plus Ultra. It's like the ideal thing because it's failure free. When I say swimming as well, I don't know if I explained this when I give you the recommendation. I don't even necessarily mean this kid has to be like Michael Phelps doing laps up and down the pool like a fish.
Exactly.
Essentially, as soon as they're in the water, imagine the sensory, what you're getting from that, the sensation of it, the pressure and compression of the water in the pool themselves. When they're submerged, they're getting that pressure. As they're moving, the water's resisting their movements all the time. They can dive up and in and out and get all that vestibular input as well. So it's really powerful. And the other element, no one's doing it to them. They get to control the interaction as well. So that's why it's hugely beneficial. There's a lot of things you can bring into your home. I love Lycra and I love swings. Those are not always accessible to everyone. There's clever and kind of OT ways to put them in most places. I've worked with parents to put a sensory room in what amounts to like Harry Potter's bedroom under the stairs before, and you can still do a little with a lot, but you've got what you've got, so you can make the most of it and you can do amazing things. As soon as the more you know about your child and the more you understand what's the barrier, if I understand them better, I can better identify their barriers, not only to academics or not only to social interactions, but to happiness and to quality of life and make their day better and brighter, then I can help them overcome these barriers. So I would say your own education, natural age-appropriate play experiences. Swimming pool is a lovely thing, or just being immersed in water in general. But also, there's so many, not only print resources and trainings, but other human beings. I'm not special. There's 100 OTs on Instagram, for example, giving amazing information. And when you subscribe to them, you get a little bit every day. There's an amazing podcast called All Things Sensory. It's truly spectacular. It's really good. So don't try and read 10 books this week. Try and just start the journey and learn a little thing every day or every week. And because you're with this kid for a long time and he's going to rely on you, so the better you can upskill, every OT doing their job really well is trying to make the parent kind of like an OT too. You guys are OTs as well. So helping you because you're going to be there for the long haul for this kid. It's a marathon, not a sprint. And that's the best thing you can do.
Yeah. And exposure, because this word we hear a lot, like expose them. But personally, I felt that sometimes in the beginning, especially parents will expose them like in the face and it backfires.
Yeah.
So what is the scale of exposure, like especially when auditory sensitivities come? People are like, let's take them to a mall, and the kids is like, they're flopping on the floor, they're screaming, and parents are frustrated, they're sweating. Like, I've been there. How do you adjust the scale of exposure, especially when hair cutting. Like I have done that. I'm guilty. Like I've done this with my twins.
Sure.
Like grab them, let's do it, and shave their head. But slowly I understood that this is not how it works. And touch wood, like, now they just go and sit down and they love their barber. And
Sure.
but it
Nice.
was like 6 to 7 years.
Yeah.
So how do you? I don't know how to put it in a
I
question.
know
I hope you
exactly.
understand.
Yeah,
it.
I know exactly what you mean, and it's based on negative experience. So in our clinic, I'll give this as an example. I have a big old TV in both receptions that has Hakini Friends. Used to be Adam's Friends, because for years I've met and befriended people all over the city who are just a little bit patient and warm and inclusive. And so families can try something like swimming or martial arts or rugby or Gaelic football and be relatively sure they'll get a soft landing. They'll speak to someone who's just patient and understands, because that experience is everything. Because a lot of my families, they want to try the new thing and they want to go to this birthday party or see this new movie that just came out, but they know from history it's going to be a rough go, man. The kid will try be there, touch wood, fingers crossed, let's hope it's a good one. And then it goes sideways and you go home, and after 10 occasions, 10 birthday parties like that, my dads will tell me, Adam, it's easier if I just circle the wagons at home, make our universe a little bit smaller than it could have been, because I can control this world. But here's the kicker, guys, and this hits the dads hard. You have to bring your child out into the world, because if you make it just you and them against the world, and you're their backup man, you've got their back against anything. But if it's you and them against the world, eventually it's just them against the world. So you do have to get them out into the community, and you have to find collaborators. You have to find therapists and professionals and supportive people and other families who can be a little link into the community and into life in all its scary glory and largeness. So those experiences, that's what's important. And the lovely thing is, you can have 10 negative experiences, but then if you have one good one, and then do that the next week and it's a bit better, there's an inertia and there's like a momentum to the experiences. Because we're OTs, we're about doing things. Occupation happens, it doesn't happen in a vacuum. It needs context. So you need to get out there, find other human beings who understand, and just have that little bit more patience. And then it's just, this is the word, it's not success, it's opportunity. So go out and try. Have, like DK said before, have your getaway driver. Have your guy there, so if it doesn't go sideways, that's okay. We tried and we can try again next week. We're not going to force anything. We do our best. Even if success is going there to the cinema and seeing the poster of the movie you like, take a selfie with it and then go home and draw a picture about the movie, or then we watch a trailer for it, or we go to the cinema, but you have noise cancelling headphones you can put on if you want. So you're giving choice and elements of control, and you always have options. And it's just that baby step forward, man, making next week a little bit better than this week. And you might get knocked back, but that's okay, because you got people around you that can help you along the way.
Progress.
Yeah.
And I had goosebumps, and it makes me emotional, because this is what I have done. Baby steps, and little progress is also progress.
Yeah,
And, I've done the cinema twice with them. And first time I went, oh my goodness, it was a nightmare. Second time I went, I just took the headphones, half movie, they settled down, they watched it with the headphones. Third time they watched the full movie.
Yeah.
But it was 2 years.
The important line that kids who do can. So if they can experience these things, they want to get out there. And when I used to do a workshop for parents in Dubai. One of the most powerful ones. It was like a big tearjerker, this one, because it's called A Brighter Tomorrow, which is a workshop, lasts a few hours, which is like 10 years from today at this hour. What does your life look like 10 years from right now? And then it's how to put the pieces together to get from here to there, and the steps you need along the way. And those sorts of things, because some of my families, man, they work so hard to get through the day and get the kids to the end of this grade level. And you're thinking, oh gosh, 10 years time, Adam, why are you making me think about these things? But this is life, man. But you find people to help you along the way, and you find practical structures and practical supports that will help you not wish for lighter burdens, but build those stronger shoulders, and have kids who develop the skills and overcome these barriers, and find communities around you that can help you along the way.
Exactly. And for Brighter Tomorrow, you need to step out of the house, go out of your comfort zone.
Yeah.
It's not easy, but it does work.
Yeah.
I'm a living example of that. I mean, struggles are still there, but we have come a long way.
Yeah.
And it's exposure is going out of your comfort zone instead of creating that bubble for yourself and for your child. I totally agree.
And the other one I'll say is, when I do Brighter Tomorrow, a lot of the parents there would have kids who are 9, 10, 11, 12, 13, 14. Some families have come to that, and the kid is 24, young adult 26, and they think, my life is just this now. It's you can develop, you can make progress at any time. You talk about a kid who's still working on potty training at 14, 15. There's never a moment where you wave the white flag. And don't think of it like a battle. You're not fighting anything. You're just helping the child overcome these little things to make a little bit of progress every day and find those supports around you as well.
So you're still doing the workshop? It sounds amazing. I want to attend it.
I was finding the chance I must, because one of the common things I'll get is parents reach out to me for kids who they were in pediatric services and they got to the end of school and they think, what's next? And you have another 60 years in front of you. Yeah. So what does that look like? So this is a very important, but I must revisit this too, because I know it's a huge demand here.
And next time you do it, we are coming.
Sure.
And DK, my last question to you would be, if there is any specific resources that helped you make parents understand the sensory world, occupational therapy.
I would say is it's more about, see, when you have a therapist, when somebody is telling you, I don't want you to blindly accept it. And this is what most of the times it happens when they feel it's a quick cure, right? So unless and until you understand, right, what is actually the thing going on with your child, as you said, crowded places, how do I handle him not screaming? There are simple solutions. Go at times when it is less crowded. It will still be natural environment, less distractive. Go with your all armors, right? Make sure that your driver is ready when he is overwhelmed. Because the best way to stop a behavior is acting before it comes. Yeah. When you know he's going to flip, you're going to waste 1 hour if you will wait for that bomb to explode, right? And then you'll say, no, he's doing that. No, it's not him. It's you. You knew it, but you didn't do anything for that.
You pushed his buttons.
Right? Same thing, as you said, swimming, amazing. Imagine I take my child, as you said, you drag them, right? Leave them. Swimming does not have to be only in the swimming pool. Just fill the tub. Let them explore it. Let them feel it, that it is less scary. Second thing is you need to analyze an activity before you put forward to it. Before you put it forward to them. Did you show them the pools, what it is? Did you take them around, what it is? If the child goes in the swimming pool, when everybody, all of us, when say, oh yeah, swimming is good for him, that does not mean he has to train. As he said, he doesn't want to be Phillips, right? We don't want him to be an expert in swimming. It's the sensory nature of that particular activity. It's not that, okay, when he will learn swimming, he will forget everything, all the systems will be fine. It's the vestibular and probe, as Adam said, which he gets. So it's more about analyzing the activity. So learn about or know about the activity you're giving to your child, right? How can you do this? First thing is see, you cannot work on one system independently. Everything comes in picture. But what do? Well, I have a 10,000 dirham salary. I will prioritize my expenses, right? I will prioritize. My child, okay, he's seeking this. I need to give this. Okay, he needs a lot of probe. Okay, I will prioritize the probe first, then the vestibular. I know he needs it. Okay, how would I do that? Increase that amount at the same time, leaving him there. Simple activity, scooter. They are afraid of, most of the parents, they say oh, he doesn't like scooter. Why? Because he cannot coordinate. Maybe he has retained reflexes. He cannot coordinate because of that. Maybe he doesn't know. But the day he will understand what sort of vestibular and probe it gives him, he's not going to leave it. He's going to just stick onto that board and keep on going. So how do you get your child into an activity depends on how less difficult you make it. Right? And to learn about all these things, you need to first understand when someone says that, okay, because I believe in giving activities to the parents rather than saying, okay, make him jump 15 times, make him swing 15 times. Oh, he doesn't need swinging 15 times today. He needs 50 times. Why? Priority. You have 10,000 dirham. First, you need to pay the rent. Then comes the food. Then comes the fuel, right? Similarly, we need to focus on those systems. And introduction is very important. How do you introduce? As you said, like, you cannot just hold him. No, introduce. Introduce them to these things slowly, gradually, in a helpful environment. Now, DK, you don't know. My child is like, he doesn't want to listen to anything, right? Make him listen in the way he does.
Yeah.
Happy hormones. The day he is happy, work more. The day he is low, leave it. Let him relax. Let him self-regulate. Help him regulate. Get along with him. The day he is very happy, do that extra bit. And that will be registered. Once it is registered, it is less scary. When it is less scary, it is more inner intent to explore it.
Yeah.
When there is more inner intent to explore it, it is more adaptation. When it is more adaptation, there are more mature ways of expression. That's how this cycle goes. The things which we think that, okay, this is going to definitely work, go to the root level of it, right? Everybody say, oh, no, he has emotional problems. Why? Everybody's touching him every day. He doesn't want to. He knows where to work. Tactile. If he has said, oh, I've been playing with him with shaving foam for so long, okay, you need to check the response. Has he ever said, no, he will always more put it on my body, make it a mess, okay? Include extra stimulation. Today you gave foam, add something else to it. Let him try it. The more exposure and more gradual exposure they will have, they will never get bored of an activity unless and until you see it on their face and their functioning. Everybody gets bored, right? Of the same thing over and over again. They have an elongated time. They do it for more extended time, right? But it's the skill how to break it. It's all about how do you make him do the things in his compliance with your expertise in an appropriate way that the environment remains happy and the child too, right? Because we want that child to go with a smile from your room. Because if he won't, next time he will be like, Mama, I don't want to go there.
Yeah.
Anger, anxiety, fear, anticipatory anxiety, like, and not knowing what's going on, what will happen. These things keep them on high alert. Okay.
Yeah.
First time when they go to a new place, you will never see them like that. They will on mom.
Yes.
And you'll like, stay away. Well, he's seeking the probe from you to settle his system, right? What do you do? Like, this is a very simple thing. They say, okay, when you're anxious, hold the ball and squeeze it.
Yeah.
Right? Why? You get the probe. It's helping. It's at the neurology. What we cannot see happens in the brain. Suddenly, one bang sound outside, we all four will run out of this room.
Yeah.
Why? We don't know. It wasn't anticipated, right? And still it happened, right? So most of the times, when you want to learn about your child's sensory systems or help him with the sensory systems, okay, first see what you're doing and whether you're doing it in the right way, right? There are ample of activities online, okay? Don't go it on OpenAI. OpenAI will confuse you rather than help you. If you happen to go, because it's a trend. It's like what we discussed, kunafa chocolate. It's a trend. I need to go. Okay, go. No problem. Pick one thing and do it right rather than picking 10 things and doing 8 in a wrong way. Right? Okay. So when you get that one thing right, that's when you put the second thing. Why? Because you have boosted the confidence and the child will accept it. You have boosted his confidence. Yes, I did this. Mama, give me more. Okay? This happens with me with most of the kids who have late diagnosis or who were okay. See, with anything that comes to our life comes denial.
Yeah.
That denial keeps us away from the reality. Okay? That reality takes time to come into picture. When we come to the reality, We start bargaining. This is all psychology. We bargain. Okay, this is lesser. Maybe he is less into this one. Maybe he doesn't need more. No, don't be judgmental. Okay, do an assessment. Assess your child. Like, you can be over optimistic, right? Optimism is good, but it is very bad when it comes without realism,
Yeah. Yeah.
right? So you got to be real and optimistic,
Yeah.
right? That's when you will help
That's fair.
your child. And about reading, you can read a number of things, but make a logic out of it. Same thing like that miracle water. Same thing like only certain therapy will work, not the other one. No, it's all integrated. And when it is multidisciplinary, I loved it. This is the real problem, what he mentioned. Like, we keep on running different places. And then this OT said this OT said this. Why? Because the day I saw him, he was different. And the day you saw him,
He was different.
different, right? And medical intervention is something that, everything that works on neurology, your brain, okay? We worked in psychiatry, like, when it works on your brain, it has a side effect. But how do they calculate it? It's that expertise that gives them the right to write down on the paper what is needed for the child, because they know that the benefits of this particular thing are more than the harm, right? You can have calcium, a lot of calcium, okay? But if you have deficiency, it will help you, okay? But no, I need a lot of calcium. If you overdo it, you will get a kidney stone. Right?
Yeah.
So
Finding the
it's
balance.
all about balancing. And parents can go to trusted sources. Okay? Anything that has to have a reference, go to those sources. Okay? Do not rely on one particular thing, not even on what I'm saying. Go and check it. Verify. Verify the claims made and think how true they are.
So where exactly people can reach out DK if they want to?
But they can reach me out in person. I'm off, like, because of the media thing, I'm a little bit off on media. But I love to meet in person. I'll tell you why. When you meet someone in person, you can read their body language, their acceptance, okay? And you can feel them.
Yeah.
I can feel their pain. I can feel what they are feeling. It's if I talk to you on your phone, you don't know what's going on, my facial expression or something. But yes, we can, like, we can have a parent's kind of
So where they can
how to
meet
say,
you? I want to meet
Georgetown.
DK with my sons. Where can I?
Georgetown. You can meet us in Georgetown. We can. I'm very happy to help parents, but the only thing is, like, because there are a lot of things that they want to know, and there is a lot of chaos in their head. I want them to have a proper length of time. So yes, with your request, we will
So they can
arrange
connect
something.
with you through Georgetown Early
Georgetown,
Intervention
yes.
Center, run by the beautiful Zahra.
Zara, yes,
Who's also
she's
an
an
autism
amazing
mom,
lady.
Yeah.
Yeah.
So people can connect with you through there, and you can take it from there.
Yeah, I'm there on LinkedIn. I do respond to direct messages.
Yeah, I'll put his
But-
details, all of you. Yeah, because you need to help. Parents need help. There are a lot of parents, and
And
I'm
the thing
sure
is,
they-
like, see, I believe in this thing, like, when you get anxious, or when you're angry, or, like, you might have heard this, okay, when you are in anger, count 10 and then respond. Why?
Why?
You are at the heightened state and you don't know what you're going to say.
Yeah. Yes.
Those 10 seconds pulls down that particular neurotransmitter, helps you settle down, then you go to your senses and then you talk. Same thing happens when new parents, usually those with the recent diagnosis for their child, okay, they come in a panic state,
Yeah.
right? And what I believe at that point, it's not the child that needs the support, it's the parent.
Thank you for saying that.
It's the parent, because parent is the cornerstone of your child's development.
Yeah.
Why? Dude, you be with him for 1 hour. She's there with him for 23. Sorry, I said she, he or she. So I got to be conscious.
So parent empowerment.
So
that's,
when the cornerstone is strong, right, then only the child will develop. Adam said it earlier, if you had noticed it. If you are against with the society, against your child with the society, that means he's alone. But if you stand next to him, right, you can fight anything. How I put it is if you won't accept your child the way he is, why would anybody else?
yes, yes,
Why would anybody else?
exactly.
Stand next to your child.
Stand
You
next
are
to your child.
blessed. Why do I say you're blessed? Because I've read this in one of the articles, one of the researchers, I guess. One of the parents said, we are the mountain climber, daredevil mountain climbers, the parent of kids with autism. I loved it. And why I mean they are blessed is because the Almighty has thought that you are the best person to take care of him. Right? You need to be stronger to make your child stronger.
Okay, you're making me emotional because
Oh,
I'm
come
too-
on. I didn't mean
Yeah,
to,
really.
but it is
I
very
truly,
emotional.
I believe that.
Because
I am truly blessed. I mean, yeah,
it's like,
I
you know,
agree. Yeah.
it's not about which tire you feel the pressure in. First, you feel the pressure in the tire which is punctured, which does not have air, right? Help the parent first,
Yeah.
then the child. Because if you are not building the pillars properly, you will not
The
have
building
a
will
proper
collapse.
building,
Yeah,
right?
I agree. Yeah, that's the story of my life. Yes.
Because this is something that everyone misses. They think that, oh, child has autism, he needs help. No, the parent
The
needs
parent
help
needs
first.
help first. Thank you for saying that. This is beautiful. Yeah, and you really made me emotional because
Please don't
it's
be.
it's
I
hard,
know
but
it-
you need to stand next to your children.
Yeah.
That's where the difference.
See, we all have this thinking, when you're on the street, if you see gold, there are three people. Beggar, oh no, this money. Second person, priest, he will say, oh, okay. Oh no, poor, somebody lost his gold. Let me take it and give it to him. A rich person, filthy rich, somebody dropped his gold. This is just a minor piece of thing, what I have. Everybody has a different perception of that particular thing. But where does the reality lies in? Gold will remain gold wherever it goes. And the thing is, me as a therapist, I will have a different perception. You as a parent will have a different perception and different challenges, right? Me just saying, oh, do this and it will help. No, that's why I said, when you do something with your child, any activity or something, analyze it. Is it the right thing you're doing? Is he getting overwhelmed? Is he not getting overwhelmed? As you said, in later stages, you started understanding, oh, okay, I know exactly what he wants. That's the parent I want. That's what I want. I want the
Thank you.
parent to know that, oh,
Yeah.
okay, I know exactly what he wants. Because if you won't know what he exactly wants, you will be in confusion. Child will be in confusion.
Yeah.
Right? But it's a colorful way. It gives an intense and immense pleasure to work with such kids. And the biggest reward for that is the smile they take away when they leave the room.
People like you make OT colorful, and I see kids when they find a therapist who goes to their level and understands it, they enter the OT room with so much joy and smile, and they run to the swings. And I have seen that. And I think behind that smile and that joy is the connection that the therapist, the OT, builds with that child. So, yeah, thank God for people like you both. Seriously, I actually mean it. And Adam, where can people find you? You work with a beautiful clinic. I really quickly want you to tell us about it.
Yeah, sure. I'm quite different. You find me everywhere. People
He's everywhere.
Yeah, people are probably sick
He's popular.
sick of the sight of my face and my voice. But yeah, so I'm all over. The clinic's called Hakini Clinic in Healthcare City. I am really proud of this, what we're doing over there, because we're trying to pair this thing where, look at the allied health team. So we have 8 OTs and 7 speech therapists by the middle of next month, and it's nearly it's 194 years of clinical experience in that team. And just the diversity and level of experience you can draw from, of having people who have, they have a level of kind of clinical trustworthiness and stability and experience. So their clinical skills are exceptional. But also the reason we pick these individuals is because they have a warmth and compassion as well. So they have the robust clinical things you can rely on, and then the level of kind of compassion and connection that families can feel like they're supported from the initial contact. And then the way allied health, so occupational therapy and speech therapy, and then for neuropsychology and psychology as well, and the way these support one another in a way that feels very natural and mutually supportive is really lovely. So families feel like it's a truly holistic experience, and that's what we've tried to do. And one of the things is just being in Dubai for 13 years, it's taught me what families really value and find it hard to find. And then we do so much with schools and how to make that school interaction and join up what happens in the four walls of the clinic with the home and the community and the classroom as well. So you're trying to help this family in every aspect of life. Even things like the thing I come back to when I do a lot of parent talks is helping the parent and the teacher understand this kid and understand the family. So even if you're looking at assessment, the only reason we do assessment is to give us information we don't have right now, so you have better information to decide what to do next. So it all starts with understanding. In the reception, there's a big quotation on the wall that says, healing begins with connection. So that connection and that rapport is the thing. If people want to find me, I'm really easy to find. So on social media, you'll see Adam, the OT. I have so many families every day. Sometimes it's just to say hi, or they want a recommendation, read material, or they might never see me clinically, but they're from another country. I still encourage people because I want them to have somewhere to turn to ask the questions that they're thinking about. If they want to connect clinically, just go into hakini.com. You'll see the WhatsApp there. Mention my name. I will be the next voice you hear when you do that. You'll get information. If you mention my name, you will hear back from me, and then I'll guide you to the right therapist to help you guys out.
You see the enthusiasm there. I love it with both of them. So Adam the OT on Insta and Hakini Clinics,
That's
which
the one.
I'm really proud of the work that you're doing.
Oh.
I've heard some really amazing reviews about you guys, and Adam is the star of your day. You will find him very, very easily. And Mr. DK, you can connect with him through Georgetown Early Intervention Center, and I am sure he'd love to meet you in person.
I would love to meet in person. The only thing is, when we have the schedule up there,
Yes, we know.
I do
you're
not
very
break
busy.
my promises, so I will definitely be there. You can we can meet in groups, and I want to meet the parents as parents.
Thank you
curious
so much,
parents to know about
gentlemen.
things.
It's never enough. I wish we could continue, and maybe we will have another episode on OT, because OT it's gained so much importance in my life, and swimming was just an example. Like, I have learned as well. Like I told you, I used to grab them and shave their heads and drag them to pool, but with swimming, I keep giving this example because I never thought that they'll go overcome this fear, and I have cried. Seriously, I have cried. Like, my kids will never be able to swim, and they have not learned swimming like strokes and laps, but they just go down the water, and I can see that it's beautiful, and because of them, I have learned swimming. So, thanks to them. So it was amazing to have you both. It was I think it was one of the best episodes I've ever had. I felt connected at every minute. And to all of you listening, sensory isn't a buzzword. It's a lens through which many children like mine see and experience the world. So you need to be really understanding and accommodating. And like both of the gurus of occupational therapy said, that you need to be standing beside your child, not against them, and support them as much as possible. And always remember that unusual behaviors, they aren't weird, they aren't funny, they are windows into unmet sensory needs. This is what I've learned from 11 years of my parenthood. Thank you one more time. I can't thank you guys enough. I know both of you are very, very busy, and we are really proud to have two amazing occupational therapists. And I hope, I wish, I pray, and I request them to maybe start a show on occupational therapy. Why not?
Your next up, Netflix.
Maybe.
Why not? You never
it
know.
can be.
It will be amazing.
It
So
is vast.
There you
It
go.
is very vast. And
thank you so much, guys, and I'll see you in the next episode of the Warrior Mommy podcast. Thank you.
Okay.
Thank